Hello everyone, now let us discuss about CPT coding guidelines for surgery, Integumentary system part 7. In the current session, we will be focusing on skin replacement surgery, flaps, which are nothing but skin and or deep tissues, other flaps and grafts. Now coming to skin replacement surgery. Skin replacement surgery is mainly composed of two elements. The first one is surgical preparation and the next is topical placement of autografts or tissue cultured autografts. The next is skin substitute grafts. Now coming to the various guidelines. As we have discussed earlier, the skin replacement surgery consists of surgical preparation and topical placement of an autograft, including tissue cultured autograft or skin substitute graft. For example, homograft, allograft and xenograft. The graft is anchored using the individual choice of fixation. When services are performed in the office, routine dressing supplies are not reported separately. Whenever the services are performed in the office, that is not in the hospital, the routine dressing supplies are not reported separately. Following definition should be applied to those codes that refer 100 square centimeter or 1% of body area of infants and children when determining the involvement of body size. They should determine or they should apply or refer 1% of body area of infants and children when determining the involvement of body size. It should be either in square centimeters or in percentage of body area. The measurement of 100 square centimeter is applicable to adult and children 10 years of age or older. And the percentage of body surface area is applicable to infants and children younger than 10 years of age. The measurements apply to the size of the recipient area. That is, the grafts must be measured either in square centimeter or percent of body area. 100 square centimeter is applicable for adult and children of 10 years or older, whereas percentages of body surface area are applicable to infants and children younger than 10 years of age. The procedure involving wrist and or ankle are reported with codes that include arm and leg in the descriptor. When a primary procedure requires a skin substitute or skin autografts for definitive skin closure, for example, orbitotomy, radial mastectomy, deep tumor removal, etc., use the appropriate codes from the series 15100 to 15278 in conjunction with primary procedure. And for biological implant for soft tissue reinforcement, use 15777 in conjunction with primary procedure. And for supply of skin substitute grafts should be reported separately in conjunction with these codes, closure codes 15271 to 15278. Now coming to definitions, the surgical preparation codes which come under the range 150022 to 15005 for skin replacement surgery describe the initial services related to preparing a clean and viable wound surface for placement of an autograft, flap, skin substitute graft or for negative pressure wound therapy. These codes, which are come under the range 150022 to 15005, they include the initial services such as preparing a wound surface for placement of these flaps. In some cases, closure may be possible using adjacent tissue transfer or complex repair. In all these cases, appreciable non-viable tissue is removed to treat a burn, traumatic wound or a necrotizing infection. The clean wound bed may also be created by incisional release of a scar contracture, resulting in a surface deficit from a separation of tissues. Usually, in some cases, closure may be possible using adjacent tissue transfer or by complex repair. In all these cases, the appreciable non-viable or non-living tissue is removed either to treat a burn or a traumatic wound or necrotizing infection. The clean wound bed that may be created by incisional release of scar contracture. And for the preparation of this clean wound bed, a surface defect may be formed due to the separation of tissues. And the intent to heal the wound by primary intention or by the use of negative wound pressure therapy. And this surface defect is usually allowed to heal by primary intention or by the use of negative pressure wound therapy. The patient conditions may require the closure or application of graft, flap or skin substitute to be delayed. But in all cases, the intent is to include these treatments or negative wound pressure to heal the wound. So in some cases, the closure may be delayed. Depending upon the patient's conditions, in some cases the closure may be delayed, but generally in all cases, usually the treatment is done either by negative pressure wound therapy or by primary intention to heal the wound. Do not report 15002 or 15005. That is the codes in the range 15002 to 15005 for removal of non-viable tissue debris in a chronic wound. You should not report these codes for the removal of non-viable tissue debris in a chronic wound. For example, venous ulcer or a diabetic ulcer, when the wound is left to heal by secondary intention. And see the active wound management codes that come under the range 97597, 97598 and debridement codes that come under the range 15042 to 15047 for this service. So usually skin replacement surgery codes should not be used for the removal of non-viable tissue in the chronic wound, for example, venous ulcer or diabetic ulcer. In those cases, active wound management codes or debridement codes are used. And for necrotizing soft tissue infections in specific anatomical locations, we must refer 11004 to 11008 series. Select the appropriate code from 15002 to 15005 based on the location and the size of the resultant defect. For multiple wounds, sum the surface area of all wounds from all anatomical sites that are grouped together in the same code descriptor. We know this point. For multiple wounds, sum the surface area of all wounds from all anatomical sites that are grouped together into the same code descriptor. For example, sum the surface area of all wounds of trunks and arms and do not sum the wounds from different groupings of anatomical sites. For example, face and arms or face and trunk. Use 15002 or 15004 as appropriate for excisional and incisional release resulting in wounds up to and including 100 square centimeters of surface area. And use 15003 and 15005 or 15003 or 15005 for each additional square centimeters apart thereafter. Let us see an example. Surgical preparation of a 20 square centimeter wound on the right hand and a 15 square centimeter wound on the left hand would be reported with a single code 15004. Because 15 plus 20 indicates 35 square centimeters and 35 is less than 100 square centimeters. For that reason, you report one code only, 15004. The description is surgical preparation or creation of recipient site by excision of open wounds, burn, eschar or scar. For face, scalp, eyelids, mouth, neck, ears, orbit, genitalia, hands, feet. First 100 square centimeters. And the next example is surgical preparation of 75 square centimeters wound on right thigh and 75 square centimeters of wound on the left thigh. And that would be reported with 15002 for the first 100 square centimeters, followed by 15003 for the second 50 square centimeters. If you can see, 75 square centimeter wound on right thigh and 75 square centimeter wound on left thigh. 75 plus 75 will sum up to 150. So 15002 for the first 100 square centimeters, followed by 15003 for the second 50 square centimeters. So the description of 15002 is surgical preparation or creation of recipient site by excision of open wounds, burn, eschar or scar. Release of scar contracture, trunks, arms, legs. So thighs comes under legs. First 100 square centimeters, followed by 15003, which is nothing but each additional 100 square centimeters or part thereof of each additional 1% or each additional 1% body area of infants and children. This is an add-on code and it must be used with 15002. 15003 is an add-on code and it must be used only along with 15002. Similarly, 15005 is an add-on code that must be used only along with 15004. And if all 4 wounds are required, all the 4 wounds require surgical preparation on the same day. That is 2 wounds for right and left hand, 1 wound each on right and left hand and 1 wound each on right and left thigh. So if all 4 wounds are required, then use modifier 59 with 15002 and 15004, either one of the case depending upon the complexity. 59 modifier is given to indicate multiple procedures are performed on the same day. Now coming to autografts, tissue cultured autografts or tissue cultured autografts. We all know that the skin replacement surgery consists of surgical preparation and topical placement of an autograft or skin substitute graft. Now we are discussing about autografts. It includes the harvest and application of autologous skin graft, repair of donor site requiring skin graft or local flaps is reported separately. The autografts includes harvest and or application of an autologous skin graft, whereas the repair of donor site requiring skin graft or local flaps is reported separately. Removal of current grafts or simple cleansing of the wound is included whenever performed. Do not report 97602. So whenever we are placing autografts, the removal of current graft or simple cleansing of the wound is included and we should not report the code 97602 along with autograft codes. Debridement is considered a separate procedure. Usually debridement is included and debridement is considered as a separate procedure only when gross contamination requires prolonged cleansing, when appreciable amounts of devitalized or contaminated tissue are removed, or when debridement is carried out separately without immediate primary closure. Select the appropriate codes from 15040 to 15261 based upon the type of autograft and location and size of the defect. The code selection is based on type of autograft, location and size of the defects. The measurements apply to the size of the recipient area. For multiple wounds, sum of the surface area of all wounds from all anatomical sites that are grouped together into the same code descriptor. For example, sum the surface area of all wounds on the trunk and arms and do not sum wounds from different grouping or anatomical sites. For example, face and arms. You can sum the wounds from arm and trunk and arms, but you cannot sum the wounds from face and arms because they come from different groupings of anatomical site. Now coming to skin substitute grafts, it includes non-autologous human skin grafts, which can be dermal, epidermal, cellular or acellular. Grafts can be homografts or allografts, and also non-human skin substitute grafts. It includes human skin and non-human skin substitute grafts. Non-human skin substitute grafts are nothing but xenografts. And they also include the biological products that form a sheet scaffolding for skin growth. Skin substitute grafts codes are not to be reported for application of non-graft wound dressing For example, the dressings by gel, powder, ointment, foam or liquid. In all these cases, skin substitute grafts codes are not to be reported, and also for injected skin substitutes. Removal of current graft or simple cleansing of wound is also included whenever performed, and we should not separately report 97602. We should not report 97602 because this is included in skin substitute grafts. One more important point is whenever non-graft wound dressings are done, they should not be separately reportable. Application of non-graft wound dressing is not separately reportable. And similarly, removal of current graft or simple cleansing of wound is included when performed and do not report 97602. Debridement concept is also same. Debridement is considered a separate procedure only when gross contamination requires prolonged cleansing, whenever appreciable amounts of devitalized or contaminated tissue is removed, or whenever debridement is carried out separately without immediate primary closure. The guidelines are mostly similar for autograft or tissue cultured autograft and skin substitute grafts. Select appropriate codes from 15271 to 15278 based upon location and size of the defects. And this is also same. For multiple wounds, we need to sum up the surface area of all wounds from anatomical sites that are grouped together into the same code descriptor. For example, sum the surface area of all wounds of trunk and arms, but we should not sum the wounds of face and arms, because they come from different groupings of anatomical sites. And the supply of skin substitute graft should be reported separately. Supply codes should be reported separately in conjunction with 15271, 272, 273, 274, 75, 76, 77 and 78. And for biological implant for soft tissue reinforcement, use 15377 in conjunction with the code for primary procedure. Now let us come to the CPTs. The first CPT is 15002, which is nothing but surgical preparation or creation of recipient site by excision of open wounds, burn, eschar or scar, including the subcutaneous tissue, or incisional release of scar contracture for trunk, arms, legs. First 100 square centimeters or 1% of body area of infants and children. And the next is an add-on code plus 15003, which must be used for each additional 100 square centimeters along with 15002. Each additional 100 square centimeters or each additional 1% of body area of infants and children. Now coming to the next code 15004. That is nothing but surgical preparation or creation of recipient site by excision of open wounds, burn, eschar or scar, including the subcutaneous tissue, or incisional release. Preparation of surgical creation of recipient site by excision of open wounds or by incisional release of scar contracture for face, scalp, eyelids, mouth, neck, ears, orbits, genitalia, hands, feet and or multiple digits. For first 100 square centimeters or 1% of body area of infants and children. And this is an add-on code plus 15005 that must be used in conjunction with 15004 for each additional 100 square centimeters or part thereof, or each additional 1% of body area of infants and children. Now coming to the codes of autografts or tissue cultured autografts. The first code is 15040, harvest of skin for tissue cultured skin autograft 100 square centimeters or less. The next is 15050, pinch graft single or multiple to cover small ulcer, tip of digit or other minimal open area except on face up to defect size 2 cm diameter. The next is 15100, split thickness autograft. Trunk, arms, legs, first 100 square centimeters or less, or 1% of the body area of infants and children. The next is an add-on code plus 15101 that must be used in conjunction with 15100 for each additional 100 square centimeters or each additional 1% of body area of infants and children or part thereof. Now coming to next code 15110. Epidermal autografts, trunk, arms, legs, first 100 square centimeters or less or 1% of body area of infants and children. The next is an add-on code plus 15111 which must be used for each additional 100 square centimeters or each additional 1% of body area of infants and children or part thereof. The next code is 15115. Which includes epidermal autograft, face, scalp, eyelids, mouth, neck, ears, orbits, genitalia, hands, feet, and or multiple digits. First 100 square centimeters or less or 1% of body area of infants and children. The next is an add-on code plus 15116 that must be used for each additional 100 square centimeters or each additional 1% of body area of infants and children. The next code is 15120 which is nothing but split thickness autograft. Previously it was epidermal autograft. Now it is split thickness autograft of face, scalp, eyelids, mouth, neck, ears, orbit, genitalia, hands, feet and or multiple digits. First 100 square centimeters or less or 1% of the body area of infants and children. The next is an add-on code plus 15121 for each additional 100 square centimeters or each additional body area of infants and children. The next code is 15130. 130 indicates dermal autograft, trunk, arms, legs, first 100 square centimeters or first 1% of body area. The next is an add-on code plus 15131. It must be used for each additional 100 square centimeters or additional 1% of body area. The next is 15135. Dermal autograft of face, scalp, eyelids, mouth, neck, arms, orbits, genitalia, hands, feet and or multiple digits. Each code has first 100 square centimeters or 1% of body area of infants and children. Additionally, there will be an add-on code. Add-on code for 15135 is plus 15136 that must be used for each additional 100 square centimeters or each additional 1% of body area if it is infants or children. The next code is 15150. Tissue cultured skin autograft. Tissue cultured skin autograft which anatomical regions are trunk, arms and legs. First 25 square centimeters or less. Here the square centimeters are different. Tissue cultured autograft, trunk, arms, legs, first 25 square centimeters or less. The next is an add-on code plus 15151. That must be used for additional 1 square centimeter to 75 square centimeters. That is after 25 square centimeters for each additional 1 square centimeters up to 75 square centimeters. You need to use the add-on code plus 15151. The next is an additional add-on code after the first 100 square centimeters. Then this code plus 15152 is used for each additional 100 square centimeters or each additional 1% of body area of infants and children or part thereof. So whenever we are considering tissue cultured skin autograft, there are 3 codes. One for less than first 25 square centimeters or less. Another add-on code for additional 1 square centimeter to 75 square centimeters. That is for the first 100 square centimeters there are 2 codes. And additionally 1 code for each additional 100 square centimeters and thereafter. So now coming to the next code 15155 which is nothing but tissue cultured skin autograft for face, scalp, eyelids, mouth, neck, ears, orbit, genitalia, hands, feet and or multiple digits. First 25 square centimeters or less. Next is an add-on code plus 15156. For each additional after 25 square centimeters, each additional 1 square centimeter to 75 square centimeters, you need to report it with plus 15156. The next is plus 15157, each additional 100 square centimeters or each additional 1% of body area of infants and children or part thereof. Now coming to the next code 15200, full thickness graft, free, including direct closure of donor site. Anatomical region trunk 20 square centimeters or less. The next is an add-on code plus 15201, full thickness graft, free, including direct closure of donor site, each additional 20 square centimeters or part thereof. The next code is 15220, full thickness autograft, free, including direct closure of donor site. Anatomical region is scalp, arms and or legs, 20 square centimeters or less. The next is an add-on code plus 15221 for each additional 20 square centimeters or part thereof. For anatomical sites, scalp, arm, legs, you need to use plus 15221. The next code is 15240. Full thickness graft, free, including direct closure of donor site. Anatomical regions are forehead, cheeks, chin, mouth, neck, axilla, genitalia, hands and feet or feet. 20 square centimeters or less. The next is plus 15241 for each additional 20 square centimeters. For the anatomical region, forehead, cheeks, chin, mouth, neck, axilla, genitalia, hands and or feet. The next code is 15260, which is nothing but full thickness graft, free, including direct closure of donor site. Nose, anatomical sites are nose, ears, eyelids and or lips. First 20 square centimeters or less, and for each additional 20 square centimeters you need to report plus 15261. Now coming to the next code category, that is skin substitute grafts. The first CPT is 15271. Application of skin substitute grafts to trunk, arms, legs, total wound surface area up to 100 square centimeters. Here, in order to give the code 15271, the wound surface area must be up to 100 square centimeters and 15271 must be used for first 25 square centimeters or less wound surface area. And for each additional 25 square centimeter wound surface area or part thereof, you must use an add-on code plus 15272. 15272 should be used in conjunction with 15271. The next code is 15273. Application of skin substitute grafts to trunk, arms, legs, total wound surface area greater than or equal to 100 square centimeters. If the wound surface area is greater than 100 square centimeters, greater than or equal to 100 square centimeters, then for first 100 square centimeters of the wound or 1% of the body area of infants and children, you must report 15273. And for each 100 square centimeters, additional 100 square centimeters wound surface area or each additional 1% of body area of infants and children, you need to use the add-on code 15274 in conjunction with 15273. These are codes for skin substitute grafts. The next code is 15275. Application of skin substitute graft to face, scalp, eyelids, mouth, neck, ears, orbits, genitalia, hands, feet and or multiple digits, total wound surface area up to 100 square centimeters for the first 25 square centimeters or less. Next, for each additional 125 square centimeters up to 100 square centimeters, you need to report 15276. That is an add-on code. It must be used in conjunction with 15275. 15276 must be used in conjunction with 15275. The next code is 15277. That is application of skin substitute grafts to face, scalp, eyelids, mouth, neck, ears, orbit, genitalia, hands, feet and or multiple digits. Here the total wound surface area is equal to or greater than 100 square centimeters. Whenever the wound surface area is greater than or equal to 100 square centimeters for first 100 square centimeter wound surface area or 1% of body area of infants and children, you need to report 15277. And for each additional 100 square centimeters or 1% of body area, you need to use or report add-on code 15278 in conjunction with 15277. Let us discuss an example. Here, a patient presents for skin ulcerations that were debrided and homografted last week. Homograft is taking quite nicely and the wounds appear to be fairly clean. He is ready for autografting. And the skin graft was applied. Here, skin graft was applied over the wound measuring approximately 60 square centimeters on the left midfoot. The length is 60 square centimeters and the location is left midfoot. The wounds were autografted with split thickness autograft. Procedure is split thickness autograft, and what are the appropriate CPTs that must be reported. So the procedure is split thickness autograft. So the first wound is 15120. Along with 58 modifier to indicate that it is a staged procedure. Split thickness autograft, location is midfoot. So face, scalp, eyelids, mouth, neck, ears, orbits, genitalia, hands, feet. Midfoot come under feet. So first 100 square centimeters or less. Here the area is 60 square centimeters. Followed by 15004 surgical preparation of creation of recipient site by excision of open wounds, scar including the subcutaneous tissue, or incisional release of scar contracture for the location feet. First 100 square centimeters or 1% of the infant and children. So for autografting, surgical preparation must be done. So along with autografting code, you need to report the surgical preparation code. That is nothing but 15004 along with 58 modifier. Now coming to next topic, flaps that can be skin or of deep tissues. So what is a skin flap? A skin flap is a healthy skin and tissue that is partly detached and moved to cover the nearby wound. And what is the basic difference from graft and flap? A graft is just a skin without blood supply, whereas a flap is transferred with its blood supply intact. Skin flaps have their blood supply intact. Now coming to flaps. Usually the codes listed, the listed regions refer to recipient area, not the donor site when a flap is being attached in a transfer or to a final site. So whenever flap is being attached in a transfer or flap is used for the final site, in such cases the codes regions listed refer to recipient area and not the donor area. And whenever a tube is formed for later transfer or whenever there is a delay of flap occurs prior to the transfer, in such cases the regions listed refer to the donor site. In case of whenever there is a delay of flap or whenever there is a tube is formed, in such cases the regions listed refer to donor site. And usually whenever the flap is being attached in a transfer or to the final site, then it indicates recipient area, not the donor site. Codes in the range 15733 to 15738 are described by donor site of the muscle, myocutaneous or fasciocutaneous flap. And the next point is codes in the range 15570 to 15738. They do not include extensive immobilization. That is, for example, large past or immobilized devices are to be considered as separate procedures. These codes, they do not include extensive immobilization. The next point is a repair of donor site requiring a skin graft or local flaps is considered an additional separate procedure. Repair of donor sites are not included. They are considered as separate procedures. Now coming to the various CPTs. The first CPT is 15570. Formation of direct or tubed pedicel with or without transfer. Area trunk. The next is 15572. Formation of direct or tubed pedicel with or without transfer. Area scalp, arms or legs. The next is 15574. It deals with the anatomical region, forehead, cheeks, chin, mouth, neck, axilla, genitalia, hands and feet. The next is 15576. It deals with eyelids, nose, ears or intraoral. The next code is 15600. Delay of flap or sectioning of flap. The region, location, trunk. The next is 15610. Delay of flap or sectioning of flap. Area is 15610. Indicates anatomical delay of flaps or sectioning of flaps at the anatomical regions, scalp. The next code is 15620. Here it indicates delay of flap at the regions forehead, cheeks, chin, neck, axilla, genitalia, hands or feet. And 15630 indicates eyelids, nose, ear or lip. Delay of flap of eyelids, nose, ears or lips. The next code is 15650. Transfer intermediate of any pedicel flap. Transfer intermediate of any pedicel flap. For example, abdomen to wrist, walking tube, any location. The next is 15730. Mid-face flap. For example, zygomatic facial flap with preservation of vascular pedicels. The next is 15731. Forehead flap with preservation of pedicel. Example, axial platen flap and paramedian forehead flap. These are some of the examples which are reported with the CPT 15731. Axial pattern flap and paramedian forehead flap. The next CPT is 15733. Muscle or faciocutaneous flap. Head and neck with named vascular pedicel. Example, buccinatus, temporalis, etc. The next is 15734. Muscle, myocutaneous or faciocutaneous flap. The region is trunk. The next is 15736. Muscle, myocutaneous or faciocutaneous flap. These are all donor sites. Muscle, myocutaneous, faciocutaneous flap. The region is upper extremity. The next is 15738. Muscle, myocutaneous or faciocutaneous flap. The region is lower extremity. Now let us discuss an example. While whistling a piece of wood, the patient sustained an avulsion injury to the portion of his left index finger and underwent formation of direct pedicel graft. Here the procedure is direct pedicel graft with transfer from his left middle finger. Immobilization was accompanied with plaster splint. What are the CPTs to be reported? The appropriate CPT is 15574. Formation of direct or tubed pedicel. Here we are undergoing formation of direct pedicel graft. Here with the transfer, code includes with or without transfer. Regions are forehead, cheeks, chin, mouth, neck, axilla, genitalia, hands and feet. Left index finger comes under hands. So the appropriate CPT is 15574. Now coming to the final topic, other flaps and grafts. Now coming to some of the guidelines, the code 15740. 15740 is nothing but flap, island pedicel requiring identification and dissection of an anatomically named axial vessel. Describes a cutaneous flap transposed into a nearby but not immediately adjacent defect with a pedicel that incorporates an anatomically named axial vessel into its design. Here, the flap is typically transferred through a tunnel underneath the skin and sutured in its new position. And then the donor site is closed directly. Whereas, if you see 15750, 15750 here, this describes flap, island, neurovascular pedicel. 15750 deals with flap, neurovascular pedicel. The neurovascular pedicel procedures are reported with 15750, and this code includes not only the skin but also a functional motor or sensory nerve, hence the name neurovascular pedicel. And the flap serves to re-innervate a damaged portion of the body dependent on touch or movement. In case of neurovascular pedicel, skin along with a motor or sensory nerve is incorporated. And as we know, repair of donor site requiring skin graft or local flap should be reported as an additional procedure, and it is not included. Now the next guideline is for random island flaps, VY subcutaneous flaps, advancement flaps and other flaps from adjacent areas without clearly defined anatomically named axial vessels, then we must report or see 14000 codes in the range 14000 to 14302. Next point is code 15769 may be used to report autologous soft tissue grafts such as fat, dermis, fascia and other soft tissues which are harvested from the patient using an excisional technique. And the autologous soft tissue grafts are then placed into defect during the same operation. And the autologous grafts that are already defined in the CPT code set, including skin, bone, nerve, tendon, fascia lata or vessels, should be reported with the specific codes for each tissue type. If you have a specific code for a specific tissue type, then those codes must be reported for each tissue type. And for harvesting preparation of injection of platelet-rich plasma, you need to use an additional code 0232T. For harvesting, preparation or injection of platelet-rich plasma, you need to report it with 0232T. And the codes in the range 15771, 772, 773, 774 may be used to report autologous fat grafting when the adipose cells are harvested via a liposuction technique prepared with minimum manipulation and then injected via cannula into multiple small aliquots to the defect. And the regions listed refer to the recipient area, not the donor area. Volumes are based on total injectable, and for multiple sites of injection, sum the total volume of injectable to anatomical sites that are grouped together into the same code descriptor. And do not report codes 11950, 11951, 952, 954 in conjunction with 15771, 772, 773, 774 for the same anatomical sites. These codes should not be reported together for the same anatomical sites. Now coming to the first CPT 15740, which is nothing but flap, island pedicel requiring identification and dissection of an anatomically named axial vessel. Now next is 15750, flap, neurovascular pedicel. The next is 15756, free muscle or myocutaneous flap with microvascular anastomosis. The next is 15757, free skin flap with microvascular anastomosis. The next is 15758, free facial flap with microvascular anastomosis. The next CPT is 15760, graft composite. Example, full thickness of external ear or nasal ala, including primary closure, donor area. The next is 15770, graft composite, derma fat fascia. The next is an out of numerical sequence code 15769, grafting of autologous soft tissue other harvested by direct excision. For example, fat, dermis, fascia. The next CPT is 15771. Grafting of autologous fat harvested by liposuction technique to trunk, breast, scalp, arms and or legs. 50 cc or less injectate. The next is an add-on code plus 15772. Grafting of autologous fat harvested by liposuction technique to trunk, breast, scalp, arms and or legs. For each additional 50 cc injectate or part thereof. The next is 15773. Grafting of autologous fat harvested by liposuction technique to face, eyelids, mouth, neck, ears, orbit, genitalia, hands and or feet. 25 cc or less injectate. Next is an add-on code plus 15774 for each additional 25 cc injectate or part thereof. The next is 15775. Punch graft for hair transplant 1 to 15 punch grafts. The next is 15776. Punch graft for hair transplant more than 15 punch grafts. Next is an add-on code plus 15777. Implantation of biological implant. Acellular dermal matrix for soft tissue reinforcement. For example, breast and trunk. Now let us see an example. A patient with alopecia presents for punch graft hair transplant. A 4 mm punch is used to remove cylindrical shaped portion of the skin with hair on it from a donor area. 14 punch grafts are used in total. They are placed in around 1/8 of an inch apart in order to maintain good circulation in the scalp. The scalp is cleaned and covered with gauze dressing. So what is the appropriate CPT? Here, punch graft hair transplant is done and 14 punch grafts are used. So the appropriate CPT is 15775. Punch graft for hair transplant 1 to 15 punch grafts. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.